Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, how's it going?
Doing great. How about you?
We're going to go over a word that I've heard so often,
Yes.
but have no clue what it is.
Well, good. That's what I'm here for then.
You know what that word is?
I do.
The word is Candida. She knows. Now you guys know. Explain it for me.
Candida. Okay. So, like you, a lot of people probably have heard of this, but don't really understand what it is or why it's an issue. So, Candida is one of the most common funguses occurring in the human body. Super normal for it to be there. It can be in the mouth, in the skin, in the digestive tract. It can cause, skin infections for some people. It can be there and be normal, or it can be there and be an issue in a lot of people.
Got it.
The issue becomes when we have too much of it. So if we get a yeasty skin rash, it's because we've got a buildup of too much yeast, Candida, on the skin. If you get oral thrush, where you have like the white tongue and all of that, it's a buildup of that Candida in the mouth.
Okay.
More what I'm targeting and talking about today is a Candida buildup in the gut. Like it's actually down into the stomach, intestines, all of that.
That seems way worse than like a skin Candida.
Yeah, it's a lot harder to treat. There's a lot more that goes into that. So how do you know if you have a Candida overgrowth? There's lots of symptoms that can go along with it. So nausea, bloating. Bloating is a huge one with Candida. And usually the bloating is like you wake up in the morning and you have like a normal flat stomach, and then you eat anything that has carbs or sugars or anything like that in it. And all of a sudden you have like this big bloated belly that looks like you're like 6 months pregnant or you've got a basketball under your shirt. So bloating's a huge one.
Now, is there seriously that much fluctuation?
Oh, 100%.
With Candida?
With Candida.
Wow.
You can be flat stomach to like this big bulge by the end of the day.
Wow. And that's what just food does that?
Just food will do that. Yeah. So bloating can be really huge with this one. Constipation or diarrhea can go either way. Chronic fatigue can actually be a symptom of this, where your body's just trying to deal with all that buildup in there. It can make you very tired. So it can come out as skin issues. I always tell people if there's something on the skin, there's something wrong with the gut. It's coming from the gut to begin with.
Yep.
For women, chronic yeast infections can actually be a sign of a Candida buildup in the gut. Recurrent urinary tract infections, irritability, mood swings, anxiety, depression, joint pain, and achiness. It can present in a lot of different ways for a lot of different people. Different ways to test for it. One thing is not testing and just going based off of symptoms. If you have all the symptoms of it and you think that's what's going on, just treat it as such. But then also testing wise, our GI map will pick up on Candida as well.
And that's just when you say pick up on Candida, is there actually like a line where it says Candida, like yes?
Yes. Yeah, and it looks for different types of Candida because there's different sub-series of Candida. But yes, absolutely. The GI map, the one-time stool collection test that we do, it has a whole section where it looks for Candida in the gut.
It kind of seems to me that like the answer is always like, you got Candida.
It's very common.
So what do we do? Like say somebody's watching this and they're like, that sounds a lot like me.
Yeah.
What do they do?
There's lots of different things that we can do. We want to treat it. We want to get rid of it. So treating it is going to get it back under control. We don't want it to lead to further health issues. So if Candida is left unchecked, untreated, it can cause damage to the lining of the intestines, which can lead to leaky gut syndrome. It can cause an increased immune response, meaning the body knows that something's wrong and it's trying to fight it. So it kicks up the immune system in the gut, but that can also lead to some issues. We can start to develop food allergies and sensitivities from this, and like I said, leaky gut syndrome. So any kind of health, gut health compromise can lead to long-term health issues. It's been linked to a lot of different autoimmune disorders, either causing them, triggering them, making them worse, things like that. So how can we treat it? One of the ways is through the Candida diet. And a lot of times I will recommend that people follow this diet for at least 3 to 4 months while we clear this out. The purpose of the Candida diet is literally to starve the Candida out. They feed on carbs and sugars. And what causes the bloating is whenever the Candida, that fungus, it consumes those carbs and sugars, it ferments it, and it releases a gas. That release of gas is what causes the abdominal bloating. So that's literally like they've eaten their meal and they're gassy afterwards, and so then it makes you gassy after your meal.
Man, That's awful.
Yeah, it is. It's a very uncomfortable experience. So step one is starting the Candida diet.
Okay.
There is an optional cleanse that you can do at the beginning of the diet. I have this as a whole printout that I always give to all of my patients. But you can do a 1 to 2 day liquid cleanse to kind of kickstart the diet, which is literally just organic bone broth and water for 1 to 2 days.
Okay.
That's helping to flush the system. Then you can go into a 3 to 5 day, basically just eating steamed vegetables. So that can be the second part of the initial cleanse phase. And the purpose of this is just getting all grains, sugars, fruits, starches, alcohol, everything is out of the diet.
Interesting.
So there's specific vegetables I recommend, but we are just focusing on tons and tons of steamed veggies to help start pushing this Candida out of the body as well.
Starve it out.
Starve it out. Then we move into the actual Candida diet. So the Candida diet is designed to eliminate the inflammation in the body and discourage the growth of Candida. First step, we're helping to boost the immune system because we're getting rid of sugar, we're getting rid of gluten. Most grains, we can still do like quinoa and brown rice and things like that, but no processed carbohydrates. We're getting rid of alcohol and all the refined sugars, all that kind of stuff. It's gone. We're not doing any high sugar fruits because even though it's fruit and it's natural, those high sugars like certain melons and grapes and things like that still will feed the Candida. We want to take away every possible fuel source for them. And then we're replacing those foods with good, healthy, fresh, organic, certain fruits and vegetables, lean organic meats, very specific grains or carbs that you can have while you're on it.
So it seems it's very specific for the first, 5 days, and then it gets into just a very healthy diet.
Right. There's still certain foods that even though they're healthy, we still avoid them on the Candida diet. I literally have a list of what to eat. I'm the kind of person, don't tell me what I can't have, just tell me what I can have.
Yeah.
So I have a list of the can haves that I provide to any patients that are thinking that they have Candida.
Okay.
And it's a pretty extensive list. There's lots of stuff that you can have, but it is still very specific. There's certain things that you don't do while you're on this.
Now, this is probably a bad question, but is there something you do to prevent it, like from happening in the first place?
So there are some risk factors for developing a Candida overgrowth. The standard American diet is a risk factor for developing Candida overgrowth.
Don't tell us that.
So a diet high in refined carbs and sugars, which is how everybody eets nowadays.
Right.
That's what's thrown in your face all day, every day. They're not advertising, hey, go get your healthy organic vegetables. It's, hey, let's go to McDonald's.
Right.
That is absolutely a risk factor for Candida overgrowth. High alcohol consumption. Come on, COVID,
Right.
Everybody became high drinkers during COVID. Elevated stress levels, also thanks COVID. Everybody has stress. So elevated stress levels are a big risk factor as well. A starting imbalance in the gut, then it will just spiral down into some sort of infection like this.
Got it.
So keeping good probiotics on board. Everybody needs probiotics. For women, birth control pills are actually a high risk factor for developing Candida.
Interesting. Okay.
Antibiotics for anyone are a high risk factor. So, a lot of women, whenever they take an antibiotic, then they have to follow up and treat a yeast infection right afterwards. It's because the Candida is always there. And as soon as we throw something out of balance, like killing off some of our good bacteria with an antibiotic, that Candida is like, hey, it's my turn, and it kicks up.
Got it.
So avoiding unnecessary antibiotics. And then diabetics are a huge risk factor for Candida overgrowths.
What would that be for? Just because, are you talking about type 2 diabetics or
1 or 2 in
Okay.
diabetics? Just the insulin irregularities and all of that. It's a risk factor for Candida.
Super interesting.
Yeah.
Okay, so we've covered.
Okay.
We've covered how to. No, we haven't covered how to treat it.
Diet wise.
Okay.
So then there's some supplements that help with this as well. Coconut oil is great for fighting Candida. It has a lot of antimicrobial properties to it. So you can take it in a capsule form. You can do like the oils mixed in with shakes, things like that. But coconut oil is great. Milk thistle is another good supplement that's really good. Milk thistle is more for cleansing the liver. So milk thistle, along with the Candida diet and some other supplements, it's going to help your liver flush all this out a lot faster. Vitamin C is great for boosting the adrenal glands, the immune system, all of that. So taking a couple 1,000 milligrams of vitamin C every day. Grapefruit seed extract is a really good supplement for this. And caprylic acid is another good one. You don't need to do the caprylic acid if you're doing coconut oil, though. And then oregano oil is another good supplement.
So is that like are you saying take all of these, or is this like, hey, these are good. These are things to choose from along with the things you can eat?
Yes.
Got it.
Yeah, pick a few. Okay. And then different brands make a Candida specific supplement. So like there's one, Candida Stat by Vitanica. That's a really good one. Candida Support by Now brand. Oh, yeah. And so those blend a couple of these other things in together. So instead of having 3 different supplements you're taking, it puts some of them in together that you take.
Now, is this, say, someone watching this kind of follows this to a T, they get rid of it. Is it, are they liable to get it back, or like what's the post?
Yeah. So you're always going to be a slightly higher risk for going back there if you go back to the lifestyle or the things that helped you develop it to begin with. Yeah. So you always it can always reoccur. If we don't get it knocked out completely, much higher risk for reoccurring. Most people can wipe this out, be rid of it, and continue to eat a good, healthy diet and do all the things you're supposed to be doing and keep it gone.
Hopefully this is from this you get like a lifestyle change permanently.
Yeah, that's the goal. We need to be eating good anyways. Come on, people. Yeah. There is a prescription medication that I do use for treating this, and for some people as well. It's called nystatin. Super old, super safe, well-tolerated antifungal medication that we do.
Is there, would that be for a specific type of person, or maybe Candidas?
Depends on the person. So more severe Candida, or people who are just like, dude, I'm over this and I want a faster fix. Nystatin's going to help knock it out quicker. You're usually like 2 to 3 weeks on nystatin and seeing really good results in that time frame, where if you're just doing diet and supplements alone, it's going to be a slightly slower process.
Got it.
We're still going to get to the same end goal. It's how fast do we want to get there, and how fast can your body tolerate getting there?
That's a huge question.
Because it is very common with Candida die-off, or with killing Candida, it's very common to have what's called die-off symptoms. And part of the die-off depends on how fast we're killing it, and then how fast your body can detox from it.
So you almost want it to be super sustainable, like a sustainable.
Nice, slow, easy. Yeah. Unless people tell me like, I don't even care, I will suffer for that week or 2. I just want to feel better faster. So die-off usually hits fast, but clears within like the first 5 to 10 days.
So it's kind of like the keto flu?
Kind of, yeah. Okay. You're getting rid of all the bad stuff in the body. So rapidly killing that Candida creates a metabolic reaction that can release up to 70 different toxins in the body.
Okay.
Symptoms of that are going to be kind of foggy brain, like you're just not yourself. Headaches, feeling really tired, feeling dizzy, intestinal distress. So you can actually amplify that gas and bloating for a little bit because the Candida is not happy about what you're doing to them. Sweating, fever. It can feel like you have a flu.
Yeah.
Skin breakouts. So the body, again, it's getting rid of it and it's not happy about it, so it's going to push it out. So you can start breaking out, getting rashes on the body, things like that can happen.
So it's kind of just as long as you know that could be a thing that happens, it doesn't freak you out.
Exactly. I always warn patients, if you're going to be aggressive about it, realize you may feel absolutely awful for the next 1 to 2 weeks.
Okay.
Again, the milk thistle helps to flush that out faster. Drinking bone broth, even if you don't do the liquid cleanse, doing bone broth multiple times throughout the day really helps. Drinking tons and tons of water to really just push everything out of the system quicker is beneficial.
Out of curiosity, is there a type of bone broth you like?
If you make your own, it's the best, but that's a big process. Getting, no sodium added organic bone broth is going to be the best. Okay. Not chicken broth, not beef broth, but bone broth.
Got it.
Because it's got the collagen that's going to help the gut.
Is there anything else we need to cover with Candida today?
I don't think so.
I feel great about this because right now I'm in the Knoxville office, and because you're the gut queen, y'all talk about Candida like it's just a normal thing.
Of course.
Now I'm going to be a part of the cool kids and be able to talk. I know what Candida is.
Exactly.
We're just talk about Candida.
You're in the in crowd now.
Guys, y'all know what Candida is as well. If you don't, rewatch this video. Do we have another gut health video we need to send them to?
The GI map would be a good one to link over to, just so you know one of the ways that we can test for this. Mm-hmm. We have a bloating video too.
We do.
But I kind of went into that more on this one too. But that could be another good one.
Guys, I think it's a good idea to check out the GI map one right now. Robin, you named it. No, you explained it. You explained it. They named it.
Exactly.
We appreciate you guys. This has been Explain This. As always, we'll see y'all next time.
Don't go away.